vida de la lluvia y de nuestras sementeras.
In Guatemala, 1 out of 10 people suffers from a physical disability or condition that can be surgically cured. But many with these conditions live in rural areas where there is no access to medical care, where fear of medical help is part of the culture, where poverty is an obstacle to good health, and those needing surgical attention don't know where to turn. That's where Partner for Surgery can help.
Partner for Surgery was established in 2001 to enable the neediest people of Guatemala to access quality surgical care by visiting surgical teams. It was born of a dream during the Peace Corps service of my son and co-founder Todd.
We organize medical missions into rural areas, during which volunteer physicians evaluate prospective patients to determine their eligibility for surgery by one of our future surgical teams. We work in collaboration with local community leaders and humanitarian organizations to link medical volunteers with rural Guatemalans who are in desperate need of surgical care.
Our mandate is to work with the poorest segment of the Guatemalan population. We do not have the means to find those patients, to go out into the rural communities and to bring those patients back into Antigua where our team can then perform the operations. So it's very important for us to have an organization like Partner for Surgery who does exactly that. They bridge that gap for us. Partner for Surgery is a very special organization. They are the link between us and the people out in the rural communities. The local area managers that they use are the ones that go out into these rural communities and they gain the trust of the people. So if they weren't there, then I think a large proportion of these people would never ever have any surgery at all. They would not seek surgery, they would not even know that there was any surgery there, they would not have access to surgery. We want to go to Guatemala and help the Guatemalan people, and there's no way that we could do this without the help of Partner for Surgery.
There's so many barriers for them to come to the city in order to be triaged there. There's over 20 languages in this country, and if you don't speak Spanish, it's very difficult for you to think about leaving your community and going somewhere you don't have any way of communicating. So we're able to break down that barrier by going to them and not expecting them to come to us. When we work out in the aldeas, we have a great opportunity to work with some of the local people there that work as translators for us, since we have to go from English to Spanish and Spanish to a Mayan language. They help us not only understand what the patient's saying, but they give us a lot of insight into some local beliefs and the local culture, because there's a lot of things that we obviously don't understand that doesn't come across in just the conversation that we have talking to people about their medical problems.
Untreated medical conditions place a heavy burden on rural communities. It is imperative that we empower individuals with good health so that they can contribute economically to their communities and end the cycle of poverty in Guatemala. Active community participation helps us to identify new patients, organize local transport, monitor post-operative recovery, and respond to patients' needs. Our local managers are leaders in their communities, fluent in the patient's languages and thoroughly trained in medical intervention so that they can assist patients throughout the entire process.
Our assistance process focuses on empowering Guatemalans to help themselves.
La gente ya me tienen mucha confianza.
The local people trust me because I am indigenous. We come from the same community, so we have mutual respect for one another. Partner for Surgery and the visiting medical teams help us a lot, but we can't rely only on them. We, the Guatemalan people, have to help ourselves.
Partner for Surgery has helped thousands of patients to live more productive lives. But there are thousands more who need our help.
I was so happy when your mission arrived. Now I am healthy and back with my family. Many women in the community need an operation, but they can't afford it. They're afraid and they feel like they're alone. I tell them, don't be afraid. They'll take good care of you.
The fulfillment of our mission is dependent on medical professionals who generously volunteer their time and skills.
I can tell you it is the most professionally gratifying experience in my career. It reminds me of why I went to medical school.
It's amazing what little things you can do that can really make a huge difference.
In addition to medical volunteers, we need financial assistance to pay the expenses of patients who couldn't possibly afford this type of medical attention on their own. With your help, we will continue to fulfill our mission of developing a sustainable infrastructure to provide quality surgical care to those in Guatemala who are in dire need. Through continued collaboration, we can make substantial economic and quality of life improvements in the Mayan and Ladino communities of Guatemala and beyond.
Dios de los cerros, Sultaca, Dios que cuida de la lluvia